here there are superficial vessels containing the muscle, platysmal muscle. And you see this muscle, the sternocleidomastoid muscle. And here you see the muscle, the vertebral muscle in the back. Here this is called the prevertebral muscle. All this is a vertebral muscle, including prevertebral muscle, scalene muscle, 1, 2, 3. This is scalene anterior, scalene medial, scalene posterior. And here this muscle of the back of the neck, which including this is a muscle is the trapezius. There are splenius capitis, semispinalis capitis, and spinalis muscle and longissimus capitis and longissimus cervicis. This muscle of the back. And the side of the vertebra, try to understand with me your neck from the back. Number 1, skin and fascia. The fascia in the back of the neck is very dense, similar to density of the fascia in the scalp. And we are lying down on our back and sleeping without any problem. Thanks to God for that. Then, the muscles which are in the back, trapezius muscle. This is the first layer of the back, trapezius muscle. After the trapezius muscle, you go into the back, which surrounds the spine and vertebral muscle. The muscle leaves the spine, it's called the spinalis. It's called the spinalis. The middle muscle is longissimus. The lateral one is splenius. And this splenius, semispinalis capitis, and splenius capitis. A muscle in the middle which is called the longissimus capitis and the longissimus cervicis. Longissimus capitis. And the muscle near the spine is called the spinalis. So that if you, as I mentioned to you now, this trapezius muscle, this is spinalis muscle, here longissimus, here splenius. But on the lateral side, there are scalenus anterior, scalenus medius, and this muscle which arises from the upper 4 cervical vertebrae, it is called the levator scapulae. If I mention to you levator scapulae, you must bring in your mind immediately nerve, cranial nerve, which are embedded in this muscle, in its fascia. And we're going to supply the 2 muscles in the neck. This muscle is sternocleidomastoid muscle, and we're going to supply in the veins of trapezius muscle. What is this accessory, spinal cord? And in this picture, what do you see also? You see a blue color. A blue color. This blue color, one surrounding all structure, it is called the general investing layer. Or investing layer. And looking for this layer, looking for it, it is spreading to surrounding trapezius tissue, forming the roof of posterior triangle, surrounding the sternocleidomastoid muscle here, and here it is spreading and continue even anterior to the infrared muscle. Here is the trapezius, surrounded by two layers of investing layer, forming the roof of posterior triangle, going to surround the sternocleidomastoid, going to surround the infrared muscle and continue to the upper side, the other side. This investing layer. And from this investing layer, there are another layer surrounding the blood vessels and the nerve. This is the carotid sheath. Carotid sheath. And you see here this trachea and esophagus. It is surrounded by a fascia which is called the pretracheal fascia. So that is the skin. This superficial fascia containing platysma. This is a deep fascia investing layer, which is the blue color. And there are a fascia covering the muscle, the vertebral muscle. And fascia which are going to surround trachea, esophagus, and thyroid gland, and the parathyroid gland. And another one which is surrounding large blood vessels at the nerve. This common carotid internal jugular vein is the biggest nerve. So that fascia is the name. It is divided into several parts. One is superficial fascia. One is called superficial fascia. This superficial fascia containing platysma muscle. Platysma muscle. And the other one, deep fascia. The deep fascia divided into two groups. One of them surrounds the muscle, and one of them surrounding trachea, esophagus, thyroid gland, and the one surrounding the vessels. The layer which is surrounding the vessels, it is called carotid sheath. It's called carotid sheath. The layer which is surrounding the thyroid gland, trachea, and esophagus with thyroid gland, it is named pretracheal fascia. معانا ولا لا؟ ها؟ معانا في اليوتيوب؟ لا ها؟ ولا في مكان بعيد؟ ها؟ This section is very important to understand your neck. أنا استعرضت فيه ولكن هو مش عليه صور، مش عليه كلام. Without words. I know that it is very difficult to understand. بس هي كلاسة، هي كلاسة. ها؟ إنه مهم. It's very important to understand your neck. Try everyone of you to draw this from this section. You can send it down to understand who you instructions are. To understand your name, you must draw this one. وهخليه المرة الجاية أعيده مرة تانية. I will read it next lecture. You see a several color. Blue color and yellow one, and you see another color which is from the yellow blue color is surrounding the muscle. And the outer one is skin, superficial fascia, containing platysma. And here anterior, you must put it in your mind, trachea esophagus. Surrounded by, if I mentioned to you that trachea esophagus, it is surrounded by thyroid gland in both sides and surrounded by green trachea fascia. And you see also carotid sheath. Carotid sheath, if I mentioned to you the carotid sheath, you must bring in your mind its containing these structures. Common carotid, internal jugular vein, vagus nerve. And I like this. You see the vertebrae. The vertebrae there are along the scoli anterior to it. And the more lateral, there are the scalenus and the scalenus medius. And the scalenus posterior is very small. And you see here a vertebra. The vertebral knot is representing the levator scalene. The vertebral, the levator scalene muscle. And here, trapezius, surrounded by the manifesting layer of the fascia. And to see this muscle of the leg, the fourth leg, where they are the part of the electrospinal muscle. You remember last year? Electrospinal. One muscle along the spine is the spinalis. One muscle along the column, it is in relation to transverse process. In relation to transverse process. It is called the longismus. It is called the outer one is spinous cavitas and semi-spinalis cavitas. هتفهم حاجة؟ نروح للنكست سلايد. معلش خليها دي بعد. لا كتير وبذكر and I want to speak with you about that this process of two loops and presence. But you, back and reverse, which are given you, there are three loops. Some persons today have three loops. Right loop is the loop purpose, and the first which attached to the isthmus and may be attached to the origin of the thyroid gland, it is called brachial loop. It is named brachial loop. Now, here you see blood vessels, what is blood vessels? Common carotid, external carotid, internal carotid. Common carotid and external carotid. What are the branch of the external carotid?
Common carotid, superior thyroid.
External. The external carotid, if you want to doesn't forget each branch again, in our needs there are birds. You know birds?
Yes.
The third gland is pyramidal loop. Pyramidal loop. It is 3 not 2. Okay? External carotid, its branch, I remember it by an example. Mentions that some American ladies found our pyramid more surprised. Looking for every letter of this one, some superior cerebral, some is superior cerebral. American ascending pyramid. Found fissure out of symptom, very posterior, more maxillary, surprise superficial temporal. So that this artery is the external carotid artery dividing inside the body gland into 2 branches. One is called superficial temporal, and the other one is called the maxillary artery. If I ask you about what are the branches of the external carotid artery, you put it in your mind immediately these words. Some American ladies found our very more surprised. Some superior. American ascending pyramid. Ladies lingua. Found fissure. A fissure, are you taking it in the head? You remember when you can feel its position? And you feel further off this muscle. Cerebral muscle. Also, this artery having a double relation to the gland. What is this gland? Submandibular gland. Well and good. I have mentioned that it is having a double relation to this submandibular gland. Well and good. Exactly. Are it is related to its superficial part or deep part? No. Facial artery, number 1, I mentioned that it is present at anterior angle of the occipital muscle. And it is related to submandibular gland. It is related to submandibular gland having 2 components or 2 parts. One is called superficial, between the mandible and myloid muscle, and the deep part between the myloid muscle and the hypophysis muscle, which gives it a submandibular type. Because this gland, it is present along the posterior border of myloid muscle. It is like that. If it is posterior border of this my hand, representing the posterior border of myloid muscle. The submandibular gland like that. This, my finger representing the superficial part. Why is this part, this one, my other part of the gland? Or it's right, the back.
You understand? So that the artery of superficial artery, it is related to the posterior end of the submandibular gland and both blood vessels, every blood vessels, also superficial artery. يبقى having double relation to submandibular gland, where its posterior end, because this gland extending in between the mental foramen and angle of magnum. Submandibular gland extends from mental foramen to it is separated from another gland. What is this gland? By what? Intimately contact to the body gland or separated from it by
Separated.
Separated by? No. No. The rotary gland separated from submandibular gland by?
Lateral.
What? Stylomandibular. Thank you. Stylomandibular. In this picture, I mentioned to you that branch of external carotid artery. And don't forget that. By example, words I mentioned to you, some American, British, Harvard, are very most surprised. Number one. Okay? Number two, here, thyroid gland, pyramidal loop. You see the thyroid gland? There are arteries going to this thyroid gland. It is accompanied by a very important nerve. Opposite nerve. Branch of it. Superior laryngeal. This superior laryngeal nerve is going to divide into internal cellular and external cellular. This artery, which is going to the thyroid gland, it is accompanied. And you see also the facial artery. As I mentioned to you that it is anteroinferior to the masseter muscle. And I mentioned that it having double relation to the submandibular gland, during the superficial part. And you see this superior thyroid artery. If you're looking for the branch of the superior thyroid artery, where they are going. You see a branch, small branch, facing thyroid membrane. This branch.
قفل النور كمان.
دكتور security حنان
Not working. Not working. Not working. It is losing is that you are, where is the it is not working. Yes. It more help يعني انا لو قعدت كده ما مش يعني لازم احط الدكتور كان فور الالكشن انا عندي ريزلت في النقطه الثانيه كنت بدرس وقتها بعد كده انا عندي دكتور Remember before I forget it, you are the lab and the sitting room open for business for you. Not يعني one of them open. Another one will be open. In Saturday. So that is, you can't come into revision of head, start, head for a practical exam which will be on Monday. The examination practical will be on Monday. So don't forget that. Also tomorrow, if you want to come in to review the lab and the sitting rooms also. For revision. Yes, models, especially Merula and Till fertilization. And the models for schedule brain which are present for fertilization and implantation. Your practical including head and embryology. Okay? No. The next exam. This exam, mandible skull, first glands, the gland. Okay? And I'm looking for the superior cervical. This branch is called supracervical. I mentioned that this superior cervical is accompanied by superior laryngeal nerve. This superior laryngeal nerve here going to divide it into two branches. One is called internal laryngeal nerve going with this arm. And the external going here to support muscle between the cortical process and thyroid nerve, which is so called cricothyroid muscle. If I mentioned to that this superior thyroid artery is the right frontal artery, external frontal. Here you see carotid sinus and there are a carotid body. One is chemical receptor and one chemical and the baroreceptor. انتوا المفروض تعرفوا كمان الحاجات دي. You can know more than me because it is physiology. The carotid sinus, carotid body. chemotherapy with carotid bar receptor. Are you sure? I will go back here and ask Dr. Muhammad about that. Here, this is carotid sinus, and there are carotid body. You know that? What is the function of this and function of that? Carotid sinus for baroreceptor. With carotid body. Chemo. I don't ask Dr. Muhammad Rajab, he tells me that.
No need, sir. No need. No need.
No need?
No need.
Sure?
Yes, sure.
I trust you. What is terminal jagular vein? Terminal jagular vein. Here, this external carotid artery, you see superior thyroid, this facial artery, one. There are artery which is called the lingual artery. Lingual artery. And here there are occipital and posterior auricular. And there are two branches. This superficial terminal and maxillary. Okay? There are equations for this artery. Looking for this. What is the artery? Simple. And what is this? Internal carotid artery. And what is this? And what is this? The patient. This one? Yes. I will ask you about question. You taking lower superficial nerve? No?
Yes.
You take lower superficial nerve?
No.
Last week. الدكتور هو بس اللي هو الصوت I wish you to get how many are in there? Central, internal, lingual, cerebral, and visual. But I wanted to tell you that you remember hygrosis muscle? What is the motive supply to the tongue? What is the nerve supply to the tongue? Hypoglycemia. All muscle of the tongue is supplied by hypoglycemia, except malatus. Except the malatus is taken from the bigger tongue. Putting in your mind and review in the next lecture, the hypoglycemic nerve having a relation to 4 or 5 hours. lower cranial you will take the growth of range of bigger access to head growth. I want to tell you that what are the relation of hypoglossal nerve to the arteries? It having a loop in the neck. This loop is embryological cause because the muscle of the tongue develop here. And then going to the tongue. So that having a loop in the neck. This loop crosses internal, external carotid artery, lingual artery, and occipital artery. يبقى كم artery؟ 4. وفي artery تاني صغير crossing arise from the occipital going to the sternocleidomastoid muscle. يبقى هو كام؟ يبقى الهايبوغلوسال ده related to how we are. Fine. هو crossing internal, external, occipital, lingual. مرة ثانية يا شباب. Hypoglossal nerve having relation to five parts. Number 1, internal, external, lingual, occipital. From occipital branch going to this muscle. This artery to sternocleidomastoid. This crossing the hypoglossal. يبقى هو crossing how many arteries? But it is crossed by artery to the sternocleidomastoid. From occipital artery. You see this artery? معلش عشان في مقاومات موجوده. You're looking for this. This is a lab, cerebral lab. Cerebral, yeah. Cerebral lab having two loops. And I mentioned to you that it is having another loop which is called pyramidal loop. There is another important in relation to this gland. One dimension now, which stands with the superior cerebellum. Your external region, and another one here between this trachea and the esophagus, and related to this artery. Related to this artery. This is the sinus of the trunk, giving suprascapular and transverse scapular, and inferior artery. To arise from this artery, subclavian artery, first part of subclavian artery. So that the inferior artery, it is related to recurrent laryngeal artery. There is two very important to learn in relation to the cerebral gland. First one, external laryngeal. The second one, between this trachea and esophagus, recurrent laryngeal. So that The surgeon must put in his mind this relation. When you're going to tie the artery, we're going to start first by vein. And starting by the middle thyroid vein. This one. يبقى أول واحد بيربطه ده. وطالب like it. Second point is going to close this artery, superior thyroid artery. It is she closing tightly near the gland. Maybe tight with part of the gland. Like get it with part of the gland. To avoid external lesion. And this artery, inferior thyroid artery, it like it away from the gland to avoid injury of recurrent laryngeal. You can put it in your mind. Number one, and this will be described to you later on by the end of this your education, to put your degree. Soil very important for you to know that. This superior thyroid and this inferior thyroid and this vein, medial thyroid vein. If other vein, there are superior thyroid vein, inferior thyroid vein, medial thyroid vein. The inferior thyroid vein arises from here. You can't find one from here and one from here. But I referred for you there important one for the thyroid gland during operation of thyroid gland. The surgeon must ligate the thyroid artery so near the gland, near the gland, here. But when ligate this artery away from the gland, يعني here, near, or the other of the gland. إنما هنا يبعد. To avoid here superior laryngeal nerve and external laryngeal nerve, and here to avoid to injury recurrent laryngeal nerve. Because this recurrent laryngeal nerve, we're going to supply the larynx. Before it enters the larynx, it divides into several branches, and this several branch surrounding this artery. Understand? Any questions? Huh? حد يفهم حاجة؟ الصورة اللي جت الأولانية قالت لنا فيها ممكن اختلاف فيها. Looking for a nerve arises from hypoglossal nerve. What is this nerve? مش خدوا بالك على المصر؟ Very important number. As a nerve is accessible. I got in here 3 files. I got in here 3 files. One for the Institute Header and one for this, and another for you having C. And I will pay you another. Okay? And every week I was not giving you one lecture for me. And I'm very high salary. ليه؟ خلاص. anyhow أنا كل أسبوع هسوي محاضرة على الأربعة. هتيجي دايما الأربع ساعات. خلاص؟ فلازم الموجودة دي أول أسبوع. معلش يمكن هو كان فيه الفايل الأولاني لا أنا لازم فيه كشف ولا لا؟ فالفايل الكشف من محل الكتب الام اس كيو في البراكتيكال الكوستي. You see this breaker effort and this scale. The growth Cerebus, Cerebus binalis, this Cerebus, Cerebus binalis rays. And here, this is Calmus anterior, Calmus medius, the venous calmus. Here is this locus colon, the vertebral muscle. And here is this vertebral fascia, or the vertebral fascia. This one, blue. Here, the resting leg. Surround the trapezius, forming group of posterior triangle, surrounding the sternocleidomastoid muscle, surrounding the infraoral muscle. The infraoral muscle, sternocleidomastoid, and this muscle is omohyoid. ده الذين الأول ما كانش في باور وان في ملايين بس حصل. اوكي؟ يجي بعد كده يا جماعه. This loss pharyngea المفروض خدتوه. يبقى المرة الجاية نرجع عليها مع بعض. طبعا loss pharyngea عشان اهي الضغطان. الريليشن الضغطان. في موتور وسنسوري. والسنسوري جنرال سنسيشن والديسك سنسيشن. يبقى الضغطان في موتور. The relation of the tongue, motor, and sensory. The motor, all muscles of the tongue supplied by hypoglossal nerve except the lateral glossus from vagus or cranial glossus nerve. The right, somewhat right cranial glossus nerve. Your body getting superior vagus. This right and this side. Okay? And this is a motor. But general sensation anterior to serve by lingual nerve, posterior served by glossopharyngeal nerve, the roots of the tongue by vagus nerve. Your general sensation, how many nerves? 3. Lingual, glossopharyngeal, and vagus. Intense sensation anterior to served by chorda tympani confusion nerve. And posterior served by glossopharyngeal nerve. By glossopharyngeal nerve. And root of the tongue by vagus nerve. By the vagus nerve. معلش بقى انا خدت زياده هتبقى على الحاجه اللي هقول لكم في حد ورا في حد طيب يبقى اتفقنا خلاص من دلوقتي لحد نهايه العام في صوت تاني هيقول لي ديسبيشن فور ايكون واضح ان الدنيا هايصه دلوقتي ها في مشاكل خلاص يا عم صلي كنت عايز المرة الجاية عشان تبقوا عارفين ان السكر الاساسي
Never.